Many people over the age of 65 do not get injured while driving. They do not fall while walking outside either. Yet every year, a surprising number of older adults collapse in one of the safest places in their home, their own bedroom. In many cases, it happens within the first few seconds after waking up. Not while exercising, not during a stressful moment, simply while getting out of bed. After more than 20 years working as a cardiologist, I have seen this situation more times than most people would imagine. A patient appears in the emergency room after fainting at home. The family is frightened, tests are performed, but the results often come back normal. No heart attack, no stroke, no serious abnormality on the scans, and yet the person still collapsed. Let me tell you about one patient I remember very clearly. His name is Arthur Bennett. Arthur was 72 years old. He was active, enjoyed morning walks, and had been managing his blood pressure quite well with medication. One morning, just before 7, my phone rang. On the other end was Arthur's wife, Susan. Her voice was shaking. She told me Arthur was lying on the bathroom floor and was not responding properly. Arthur had simply woken up, sat up quickly, and walked toward the bathroom exactly the way he had done for decades. But this time, his body reacted differently. By the time he reached the sink, he felt dizzy. Within seconds, he lost consciousness and collapsed. What makes this story important is that Arthur was not seriously ill. In fact, many of his medical tests later looked completely normal. The real cause turned out to be something far more common than people realize. A simple morning habit that millions of people over 60 repeat every single day without thinking about it. And once you understand what that habit is, you may never start your morning the same way again. Arthur regained consciousness a few minutes later. By the time the ambulance arrived, he was awake but confused about what had happened. He remembered getting out of bed and walking toward the bathroom. But after that, everything felt blurry. At the hospital, the emergency team performed the usual examinations. His heart rhythm looked normal. His blood tests did not show signs of a heart attack. Brain scans showed no evidence of a stroke. For many families, this is the moment that creates the most confusion. Someone collapses suddenly at home, everyone fears the worst. Yet the tests come back almost completely normal. The question then becomes very simple but very important. If it was not a heart attack and not a stroke, why did the person faint? That was when I first spoke with Arthur and his family. My name is Dr. Michael Harris, and I have spent more than 2 decades treating patients with cardiovascular conditions, especially adults over the age of 60. During our conversation, Arthur's daughter Laura joined us. Laura works as a nurse practitioner, so she immediately began asking questions that many people might not think to ask. She asked Arthur what time he had taken his medication the night before. She asked whether he had drunk any water before getting out of bed. And then she asked one very simple question. How quickly did you stand up after waking up? Arthur paused for a moment and shrugged. He said he had done what he always did. The alarm rang. He sat up, quickly swung his legs off the bed, stood up, and walked straight to the bathroom. For most of his life, his body had handled that routine perfectly well. But things change as we grow older. When someone in their 20s or 30s stands up quickly, the body usually adjusts blood pressure almost instantly. The heart rate increases slightly. Blood vessels tighten and blood continues flowing to the brain without interruption. In older adults, that response can take a little longer, and when several factors combine medication. Mild dehydration after a full night of sleep and a sudden change in posture. blood pressure can drop for a few critical seconds. Those few seconds are sometimes all it takes for the brain to lose adequate blood flow. And when that happens, dizziness, fainting, and dangerous falls can occur. What surprised Arthur the most was learning that his experience was not unusual. In fact, there are 3 common morning mistakes that many people over 60 make without even realizing it. Arthur's experience may sound unusual, but in reality, it reflects a pattern doctors see very often in older adults. Over the years, I have noticed that many patients above the age of 60 unknowingly repeat the same 3 morning mistakes. These habits feel completely normal because people have followed them for decades. But as the body changes with age, those same habits can begin to create real risks. Let us start with the first mistake. The first mistake is standing up too quickly after waking up. When you have been lying down for several hours during sleep, your body is in a relaxed position and blood is distributed more evenly throughout your system. The moment you stand up, gravity suddenly pulls a large amount of blood toward your legs. In a healthy and younger body, the nervous system reacts almost instantly. Blood vessels tighten slightly, and the heart pumps a little faster to keep blood flowing to the brain. However, as people grow older, this response can slow down. The adjustment may take a few seconds longer than it used to. During those seconds, blood pressure can temporarily drop, which may cause dizziness or lightheadedness. The second mistake is starting the day while the body is still dehydrated. Many older adults limit how much water they drink in the evening to avoid waking up during the night. While this habit is understandable, it often means the body wakes up slightly dehydrated after 6 to 8 hours without fluids. When the body lacks enough fluid, blood volume can be lower than normal. That makes it harder for the cardiovascular system to maintain stable blood pressure when changing positions. The third mistake is immediately taking medication or drinking coffee before the body has fully adjusted. Some people keep their medication next to the bed and take it the moment they wake up. Others go straight to the kitchen and start the day with coffee before their body has even stabilized from the transition between sleep and wakefulness. Both medication and caffeine can influence blood pressure and heart rate. When combined with sudden movement or dehydration, they may increase the chance of dizziness. None of these habits are dangerous by themselves in every situation. But when several of them occur together, especially in adults over 60, they can create the exact conditions that lead to fainting or falls. The good news is that small changes in the morning routine can make a meaningful difference. In fact, there are 6 simple habits that can help your body adjust more safely when starting the day. The encouraging part of Arthur's story is that his situation was preventable. He did not need a complicated treatment or a new medication. What he needed was a safer way to begin his morning. Over the years, I have shared a simple routine with many of my patients. It does not take long, and most people can complete it in just a few minutes. These 6 habits help the body transition gradually from sleep to standing. The first habit is to take a few slow, deep breaths before moving. When you wake up, resist the urge to move immediately. Instead, stay still for a moment and take several slow breaths. This helps the nervous system shift gently from a resting state into an active state and prepares the cardiovascular system for movement. The second habit is to move your feet and ankles while still lying in bed. Small movements, such as flexing your feet or rotating your ankles, activate the muscles in your lower legs. These muscles help pump blood back toward the heart, which can reduce the amount of blood that pools in the legs when you eventually stand. The third habit is to sit on the edge of the bed for about 1 minute. Rather than going straight from lying down to standing, move slowly into a sitting position and pause there. Sitting allows your body to adjust gradually to the effect of gravity before you fully stand up. The fourth habit is to drink a glass of water before leaving the bedroom. After an entire night without fluids, the body often needs hydration. Drinking water helps increase blood volume and supports more stable blood pressure when you change positions. The fifth habit is to stand up slowly and keep a hand on something stable. When you stand, do it carefully and stay close to the bed or a nearby surface for a few seconds. This simple precaution provides stability while your body finishes adjusting. The sixth habit is to monitor your morning blood pressure and discuss it with your doctor or pharmacist. Many people only check their blood pressure occasionally, but morning readings can reveal useful information. Recording these numbers and sharing them during medical visits can help healthcare professionals identify patterns and adjust treatment if needed. These habits may sound simple, but small routines practiced consistently can significantly reduce the risk of dizziness and falls. And in Arthur's case, adopting these changes made a remarkable difference in how he started his mornings. Arthur Bennett returned home later that day. Physically, he recovered well, but the experience changed the way he looked at something as simple as getting out of bed in the morning. When we spoke again during his follow-up visit, Arthur told me something interesting. He said that for most of his life, he had never thought twice about how he started his day. Waking up, standing quickly, and walking across the room had always felt completely normal. But after that morning, he realized that small routines can carry different risks as the body changes with age. In my own experience as a cardiologist, I have seen many situations similar to Arthur's. What surprises most people is that the cause is often not a serious disease, but a combination of small factors such as sudden movement, dehydration, after a night of sleep, and the natural changes that happen in the cardiovascular system as we grow older. That is why I often encourage my patients to slow down their mornings just a little. The few minutes after waking up may seem unimportant, but they are actually a moment when the body is adjusting from rest to activity. Taking a few slow breaths, sitting up, gradually drinking some water, and allowing the body time to adapt can make a meaningful difference. However, it is important to remember something very important. The information shared here is meant for educational purposes. It should not replace professional medical advice, diagnosis, or treatment. Every person's health condition is different, and if you experience frequent dizziness, fainting, or sudden weakness, it is essential to speak with your doctor or healthcare provider for proper evaluation. What I hope you take away from this story is simply awareness. Pay attention to how your mornings begin. Listen to your body. And if something feels unusual, do not ignore it. Sometimes the smallest adjustments in daily habits can help prevent much bigger problems later. And for many people, a safer morning routine may be one of the easiest ways to protect their health.